Good morning, everyone. On behalf of Department of Pathology, Sri Devaraja's Medical College, Kolar, I welcome you all for today's webinar on topic Innovative Methods of Assessment in Pathology for Undergraduate Teaching in Medical Education in CBME. To deliver the talk, we have an eminent speaker and also a legend of pathology, Dr. Harshmohan sir with us. I welcome you, sir. And to introduce this today's speaker, I invite Dr. Kalyani, Professor and Head, Department of Pathology, Sri Devaraja's Medical College.
A very good morning to all the ladies and gentlemen. As you know, today's the guest lecture from the well-known pathologist across the globe, Dr. Harshmohan, and the title is The Innovative Methods of Assessment of the Undergraduates, that is in MBBS in the CBME curriculum. As you know, we are in the phase of transition from the curriculum-based education to the competency-based education, and this is the need of the hour. So I would like to introduce the speaker. Sir, this is second. Sir has completed MBBS and MD from PGMS Rohtak, and he is a gold medalist. Sir was former professor and head Department of Pathology, Government Medical College, Chandigarh from 1994 to 2015, and formerly Faculty of Pathology, that is PGMS Rohtak, from 1977 to 93. Sir is at present the Senior Consultant, Head Histopath and Cytology Services, Dr. Gaur Path Lab, Paras Hospital, Haryana. Sir has more than 300 publications in indexed national and international scientific journals, and also several presentations and guest lectures in various conferences, and also CMEs and slide seminars. Sir has authored 8 books in pathology, which also includes in Spanish and Slovak language in multiple editions, and Sir has been conferred National Award. Sir is a reviewer of the national and international journals, a referee for UICC Geneva, National Book Trust, Delhi. Sir was editor-in-chief for IJPM between 2003 to 2007, and also president of IAPM 2008. And Sir is the member and the fellow of National Academy of Medical Sciences, and also fellow of UICC and fellow of ICP and DSI. Sir also has to his credit ICRETT UICC Fellow, Holland, and Sir was ex-visiting professor, UMass US and Ores University, Aruba, Caribbean, Colombo, and Sri Lanka. Sir has a good number of awards to his credit. A few are the Excellence in Teaching Award 2008, Haryana Vignan Ratna 2010-11, and State Honor by Chandigarh Administration 2015. I would like to welcome all the delegates who are attending for the today's talk. And I think the delegates are very eager to see Sir and also to hear from Sir. Over to Harshmohan, Sir.
Sir, you can share your screen, sir.
Yeah, sure.
And participants, if you have any questions, you can raise your hand so that we'll unmute you.
Is it there?
Yes, sir. Can you put it for slideshow? This one, sir. Slideshow.
That's what I'm looking at. This one is blocking my view.
No, double click the first slide.
Yes, sir.
No, it's not still in the slideshow. It should be full screen.
Yes, sir. Yes, sir.
Mm. I think I'm having little problem there.
Sir, you can go to slideshow in the top, sir. Slideshow.
Just a minute. Generally, it shows in the bottom, the window here. It's not showing here. Where is it gone? Shall I go back into it and then restart?
Top, there is slideshow, no, sir. After animations, you can go to that option. Yeah.
Toolbar, sir.
Ah.
Yeah, toolbar.
Next, there is slideshow. Yes, sir.
Huh.
Yeah.
Is it all right now?
Yes, sir.
I'm in
Then
slideshow now.
set up slideshow.
One step down, sir.
In that, there is setup slideshow, sir.
Okay.
Yes.
Yeah.
No. 1 second, sir. From beginning, sir.
Current slide also.
You can put it from current slide, sir. Yeah.
Is it all right now?
Okay, sir. Okay, option.
Buy your dream car at 0% down payment only.
From current slide.
From current slide, sir.
Yeah, there.
Top. In the toolbar.
Yeah, correct. From the current slide.
Set up slideshow.
Current slide, sir.
Current. Go to the left, sir. Left.
No, sir.
Left.
Yeah.
No.
Generally, it shows in
Yes.
the window on the bottom, but this one, I'm sorry to delay this. Good morning, everybody. My apologies to you for a little delay in this technical thing. And there was some problem just before I came online because there has been a power failure. So we had to set up another internet connection for this presentation. It's been my pleasure to be associated on this forum with all of you, and I find a galaxy of delegates and dignitaries there. Right in the morning, I could see Professor Kumar and Professor Lanjivar, and all this made possible, and Professor Sundaram. All this has been possible because of the efforts by the host institute to have such galaxy of people in this interactive forum. Now, I have been assigned to speak on various newer methods and modalities of assessment in pathology for undergraduates as per competency-based medical education. Now, all of us are new to this entire scheme, which has been implemented from the batch of MBBS that was admitted in 2019. And the first batch came to pathology in 2020, who either were taking exam in 21 or are taking exam in 22 now. In some of the institutes, the exams have been delayed because of pandemic. So the first batch is taking the exam in pathology now under the new scheme. So all of us are new. So we are basically sharing experience with each other. And I would share my experience, and I will like other senior faculty members to give their experiences as well. we always highlight the significance. Can some of you mute the mic and speaker, please, because I can hear some noises. Yeah, thank you. Now, we have always utilized the towering physician of previous century, Professor Sir William Osler, who was a physician who was dedicated to work in pathology as well. Professor Lanjevar would remember we had gone to this institute in Canada during our conference of International Academy of Pathology, where we found in the museum there was a register which was written by Professor Osler on autopsies which he had performed himself. And this saying, the dictum by Professor William Osler, that your practice of medicine is as good as is your knowledge and understanding of pathology. He practiced this. He followed this in his life because he was a physician who was dedicated to work in pathology as well and used to come to pathology department and perform autopsies and write down autopsies himself. This is one of that register which is displayed in the museum in that institute. Now, the faculty of pathology is assigned variety of roles. They have a role in teaching of MBBS, MD, DNB, paramedical courses, BDS, and so on and so forth. They are associated with the sign-outs or diagnostics, and of course, they are associated with either carrying out research projects of their own or guiding theses, and then in the process, bring out that information as a document or in the form of publication. So that's what they all do. That's what is domain of biomedical writing, which we will share in some other time in a forum. Now, besides writing of all this, the other thing which is important for a teacher is the communication skill. So a written communication is one component, other is the verbal communication. So the teacher has to be an effective communicator as well. That communication will have to be either with colleagues or with students or with patients or users of your talent of variety of types. But it's important to communicate effectively as well. And that is an important quality of being a teacher as well. Now, this is also emphasized in the current competency-based curriculum as well. Now, competency-based medical education developed by National Medical Commission for undergraduates has been made effective from MBBS batch admitted in 2019. And as I said, the first batch came to pathology in 2020, who became eligible to take the exam in 21, and they may be taking the exam or may have taken exam already because of delays in all that. Now, this competency-based medical education has emphasized on three other things as well, besides the competencies related to academics. Those are attitudes, ethics, and communication, commonly abbreviated by National Medical Commission in this CBME as ATCOM, that is the attitude, ethics, and communication, abbreviated as ATCOM in their booklet. So that becomes an important component as well in competency-based medical education. The other thing which forms the basic format of the competency-based medical education is an early exposure to clinical site. Now, rather than compartmentalizing preclinical, paraclinical, and clinical sciences as rigid compartments, there is an integration, and therefore early clinical exposure or interaction with the clinical site starts right from first year itself, is another component of the CBME. Now, the learning has to be directed based on the competencies defined for different subjects. Now, different topics have been divided into subtopics and competencies defined. And those competencies form the curriculum. So the competency-based curriculum forms the basis for learning of the students. And in that, there are various aspects like must know, may know, desirable to know as well. And the assessment or evaluation of the students is also based on those competencies. So therefore, you cannot go by the traditional way of assessment as we have been practicing over decades, but follow the CBME curriculum, which forms the competencies. The assessment will also have to be competency-based assessment called as CBA or competency-based assessment. Now, because of the early clinical exposure of the students, the National Medical Commission in CBME has evolved an alignment with the other subjects. Now, I use a broad term of other subjects. Other subjects means it could be alignment which is horizontal, or it is an alignment which is vertical. When we say horizontal alignment with regard to second prof, it means alignment with the other sister subjects which are taught in second prof, like microbiology, pharmacology. And likewise in first prof, it will be anatomy, physiology, biochemistry. So that's what is called as the horizontal alignment. The other is a vertical alignment, which is across the profs, which means the alignment of pathology with biochemistry or anatomy, or alignment of pathology with medicine, surgery, OB/GYN, or pediatrics, and so on. So that's what is called as vertical alignment. And there is an attempt at integration of these pre and paraclinical sciences with the clinical sciences by integrated learning. And that's why the curriculum in second prof has reduced to about 11 to 12 months. And part of that part of that pathology is covered in clinical sciences later. The other thing which comprises this CBME is the practical training or skill training, which is equally important for training as well as in evaluation. Now, this is made little complex way of teaching, learning, and assessment for those who have been in teaching profession for decades, because they have been practicing over the decades, and it's a big change for them. And that change cannot be brought about overnight, and therefore that evolution has to take place slowly in the system. Now, the nuances of learning and performing as per competency-based medical education emphasizes that learning is a continuous process for life. So the learning, whether of knowledge or practicing skills, is a continuous process and not one dead point that we've cleared pathology and now there is no need to look back on pathology. So therefore, that has to be a continuous process, has to be emphasized on the undergraduates or learners. And that's because they have broken the compartments. So the clinical exposure starts early, and part of our subjects are covered either in the later profs with other subjects, and part of it is covered overlapping with even preclinical sciences as well. Now, CBME, as regards pathology is concerned, which is abbreviated as PA in their curriculum, has given 36 topics. And those topics, which we used to call them as systems, they are called as topics in CBME language. In that 36 topics of pathology, they have defined 182 competencies or outcomes. And these are total outcomes. The outcomes are in the form of, either the theoretical lectures or group discussions or the skill labs or the practical classes. So those include barely about 20 skill lab tests here, because a lot of histopathology has been removed from the CBME competencies or must know, but it's desirable to know for learning the clinical sciences. The CBME has also laid down variety of methods of the teaching and training, And that includes by lectures or practical classes or group discussion. And they've also come up with the competency-based assessment methods as well. And as I said, they have defined them as core competencies, which also are called as must know. And then there are non-core competencies, which we call them as desirable to know. Now, in general, there is a lot of emphasis on basics of pathology in second prof. So broad principles of disease processes like cell injury, the inflammation and repair, or cellular changes which take place either in neoplasia or other growth disturbances, or the hemodynamics, and some of those infectious diseases or genetic diseases comprise the basic principles of disease processes. They have emphasized on that. They've also emphasized on updating the knowledge, and the students be apprised of the changing classification systems or nomenclatures or terminologies or definitions with changing times. So they need to be updating all that with passage of time. And a lot of those classifications or nomenclatures are going to be applied in clinical sciences, and therefore a lot of that is, as far as skills are concerned, shifted to clinical sciences. Now, what are competencies? Competency does not mean that you've learned it and that's the end of it. Now, it's not all or none phenomena that it's complete. It's endpoint of learning. The endpoint of learning which needs to be assessed by a variety of assessment criteria, whether during teaching or before teaching or after teaching or end of the course. So those are kind of assessments which are assessed for endpoint learning. And these competencies are not dead ends. They are incremental. As the student grows, the competencies also need to be evolved in a progressive manner, in an incremental manner. And teacher is not supposed to blurt out all the information load to the student. A lot of that learning is assigned to the student as self-directed learning. Teacher is a facilitator. So teacher is helping the learner to improve in an incremental manner as regards the competencies are concerned. And the emphasis throughout is the application of those competencies or learning in clinical context, because ultimately those are the users of the talent of the would-be doctors, the patients. And the other aspect which is included in competencies is the integration of knowledge with skills and the ethical aspects or attitudes to the learning. Now, the competency-based assessment has to therefore form a part of that learning of competency. So therefore, the criteria have to be evolved for competency-based assessment, which need to be integrated into the learning process. Since there is a lot of integration between the subjects, like horizontal or a vertical form of integration, if feasible, then it is possible to have integrated way of assessment, but that is generally not feasible. So to the extent feasible, integration of assessment can also be done, but without losing the identity of a specialty, that the specialty loses relevance in an integrated assessment criteria. Although learning can be integrated, assessment is very complicated if it is made integrated. I have included in the revised reprint many of these competencies listed out in a color coded in my reprint. It is not to promote the book, but it is just to share my awareness about it, that all those which are listed as competencies in the CBME under PA or pathology have been listed out here as the outcomes are core must know, non-core under this color, and assessment methods are written or the practical or skill type, and they have been color coded like this to make it apparent what are must know and what are desirable to know and what is the criteria of learning and evaluation, like the practical and skill is shown in a different color and so on. This just to share my experience on awareness about this curriculum. Quickly, I pass on to the assessment module now, which the National Medical Commission, which has superseded Medical Council of India, has developed. Now, this assessment module has been developed in 2019, and this assessment module is the backbone of the evaluation criteria. Now, it is made apparent in this module that teaching by the teacher, learning by the student are as important as is their evaluation or assessment. If a student is not assessed or evaluated, the system is not testing the endpoint. So it is not learned if it is not assessed. So therefore, it's important to assess. It doesn't mean an end of the term exam only. Assessment can be variety of ways. But if not assessed, it's not learned, forms the basis of the assessment under competency-based system. Now, so therefore, assessment is a crucial element of learning in CBME. Now, assessment, as I said, is to evaluate the attainment of particular endpoint and also maintain those endpoints and further progressively grow as the student grows. So therefore, that evaluation has to be continuous in later profs also about the knowledge gained about the previous subjects because of the integration with other subjects. Now, assessment, in addition, has also to focus on the feedback or input to the learner. That is how the student has been progressing. So input on progress of the learner is to standardize or to record the improvement that the assessment on a previous turn or a term exam was like this, and how to improve it and to see whether there is an apparent improvement as such or not. And the other important criteria for assessment is the attainment of right sets of knowledge, the practical skills and attitude to it rather than just doing the exam. Now, what are the types of competency-based assessments? There are, in general, three types of competency-based assessments, or CBA. One is structured formative assessment, other is periodic internal assessment, and third is end-of-phase periodic summative assessment. Now, those are the three types. I'll come to that in the next slide. What are these? Besides these three types of competency-based assessment, the structure formative, periodic internal, and end-of-phase or university exam, in addition, there has to be an effective feedback to the learner, or biphasic actually. The teacher should also know how he is doing. So there has to be feedback on both sides, how the teacher is doing and how the student is learning in the process. And the other is to assess and document competency in record books. So that also should become part of the assessment, and the assessment should not remain focused on theoretical knowledge only, but assess the skill acquisition as well. That is the practical aspects. What are these types of the competency-based assessments? Now, summative assessment is the end of the term exam. That's the university exam, and generally left to the universities only who follow the CBME all over the country. So therefore, summative assessment, where there's a moderator for the paper and all that is defined there. I'm not going into that because that is a assessment which is assigned to the universities. There is a formative assessment, which is during the ongoing teaching session. A part of it will be in the form of feedback, and that's mutual feedback. That will help in improvement in the learner, and it will help improvement in the teacher as well if you get a feedback from the students in a formative assessment module. And third is the internal assessment, which is by periodic tests during the phase, like in second phase of learning. What have they learned and how they have learned? So therefore, the assessment by theoretical tests as well as by skill acquisition criteria need to be evaluated. So 3 forms of assessment which are carried out during the course are summative, formative, and internal assessment. And during these assessments or evaluation, the 3 aspects which are evaluated include the 3 domains of learning. Those 3 domains of learning are abbreviated as CAPS. CAPS is for cognitive, affective, and psychomotor. So the cognitive learning is the thinking, the analytical approach, rather than just learning by rote. The affective is the emotions or feeling. That's the kind of learning that the would-be doctors become compassionate human beings as well, caring for the patients. And third is the psychomotor or physical, which includes performance of the skills as well. So these 3 domains of learning are assessed by variety of assessment criteria. The theoretical exams are the assessment of knowledge. In that, theory examination is in the form of the tests which are conducted during the phase and end of the term exam as university exam. And the CBME has defined the broad principles of those exams at the end of the phase in the form of a combination of long answer questions or essay type questions, short answer questions, and the multiple choice questions. So it should be a combination of 3 forms of questions: the long answer, short answer, and MCQs. Then are the practical, and the examination scheme is of course defined, which our teachers know it well, how the 2 papers are divided, and within the paper, that's what should be the broad division of the questions in long answer or essay type or short answer or short notes and MCQ. The other is the evaluation of the skills or practical exam, which is in the form of objective assessment of skills and their proficiency. So it should not be subjective, and therefore there are criteria by which more objectivity is added to assess the learner in acquisition of skills. And that is mainly going to evaluate the psychomotor and affective domains, and that is done by objective criteria such as by objective structured practical exercises or objective structured clinical exercises. So OSPI and OSCE should form a part of that assessment criteria. Another assessment modality for undergraduates is the viva or oral examination, which assesses their communication skill as well as their analytical skill of interpretation, identification of various things rather than learning by rote only, and their attitudes to the subjects and the specialty and the ethics during the learning phase. Now, coming to each of these components, which form an important domain for all of us as teachers, how to frame those questions in a way that the evaluation is made more objective and also in line with the requirement of the competency-based medical education. Now, long answer questions should not be one-liner. They should focus on a problem. They should test the knowledge, all right, but it should not be just testing the knowledge, but the applied knowledge, and integrate that knowledge with other disciplines. The language of the questions and the head of the question should be such that it's kind of problem solving and applied aspect of knowledge. So it's not a good idea to give one-liner questions in the theory in long answer questions or essay type questions, and also avoid simple recall questions. That also is learning more by rote than applied aspect. Another thing is that we should have structured questions like clinical scenario based questions And the various components of that question should have prefixes with each question. And each of those prefixes, etiology, pathogenesis, morphology, or complication, or whatever, should have the marks distribution given alongside, so that the learner knows what is the weightage for each of the components in that essay type question. So that is the guideline for preparing essay type questions or long answer questions. I'll give you some examples subsequently. Then are the types of short answer questions, which are more in the form of the task-oriented questions, which are to be attempted in a short time. And these are in the form of short notes or reasoning or applied aspects or comparing and contrasting features of closely simulating conditions and so on. So this aspect, I think most teachers are very familiar, the short answer questions in the form of short notes. But they should also be framed in a way that they tries to test the integration with other subjects as well. Attempt has to be made that these questions are also in the form of integrated knowledge assessment. Sorry. So besides integration, these questions should be having such a language that they test the analytical capability of a learner rather than straight questions. And they have recommended that one question out of those short notes should be on ACOM, that is ethic and communications, that is the attitude, ethics, and communication. Then are the third component of the knowledge evaluation is by MCQs, multiple choice questions. And they have recommended that the MCQ should not have more than 20% weightage in an examination. And the MCQs should be such that there are 4 options or 4 answers to the stem of a question. And out of that, single correct response is what is recommended. The MCQs should be preferably clinical scenario based, or at least majority of them should be clinical scenario based, and should avoid, again, the questions which are in the form of single liner or the memory based questions only, or testing in with the stem of the question, which is in the form of negative terms, that which one of the following is not a part of this syndrome. It's preferable not to have negative terms in it. And questions such as, out of 4 options, 3 options are given and 4th is all of above, or 4th is none of above, are not recommended. These questions are not good questions. So one-liner questions or negative liner questions or questions having all of above and none of above are not good questions. So it's preferable to have questions which are clinical scenario based or which test the analytical capability and integrated approach. Now, let me give you some of the examples of questions which I could think in theory and also evaluation in the skill. Now, for example, one long answer question can be, what is a granuloma? Write classification of granulomatous conditions with examples. Discuss etiology, pathogenesis, and sequelae of primary pulmonary tuberculosis. Now, there are various components in this long question. What is a granuloma? Is a definition, carries 2 marks. Classification of granulomatous diseases with examples, which means groups of granulomatous conditions, infectious, non-infectious, and within infectious, what are the examples? So therefore, groups with their examples carries 2 marks. And then discuss etiology, pathogenesis, and sequelae are 3 components in it. Now, these 3 components in it, each of them carry 2 marks, and therefore, sorry, where is that? Yeah, each of them carry 2 marks. So 2 into 3 makes it 6 marks. So each of the 5 components in this long question or essay type question carries 2 marks. 2 marks for granuloma definition, 2 marks for classification of granulomas, 2 marks for etiology, 2 marks for pathogenesis, and 2 for sequelae of primary pulmonary tuberculosis, all these 3. So we have to be more specific and pinpoint that we are asking about primary pulmonary tuberculosis and not all about it. We can't say write an essay on primary pulmonary tuberculosis or describe granulomatous diseases. That's a one-liner question. So that is not recommended. It should have compartments within it, break down the compartments and give relative value or distribution of the marks to each of those components in the long answer question. Another question, which is a clinical scenario based question, which I have framed, is let's say a 3-year-old female brought to the hospital by the mother with persisting pallor, failure to thrive, and prominence of forehead. The mother too has chronic anemia. So that's a very brief history given about the child as well as the mother. What is the provisional diagnosis? By this, can I remove this bar? Can you help me? Can I hide this bar? Hide video panel.
Which one, sir?
This bar at the bottom is obstructing part of it.
You can shift it to the top, sir.
Okay, that will be better. Yeah, that's better. Thank you.
Yeah.
That's better because this distribution of marks was not visible. Okay, so in this, what is the provisional diagnosis? I come back to it. 3-year-old female child is brought to the hospital by the mother with persisting pallor, failure to thrive, and prominence of forehead. Mother too has chronic anemia. So that's a brief history about the baby and the mother. And the questioner has asked, what is the provisional diagnosis? Carries 1 mark. What other conditions need to be considered in this kind of setting? Whether you can think of other chronic hemolytic anemias, give some chronic congenital hemolytic anemias like spherocytic anemia. Then what are the likely physical examination findings of this child? Describe all those features. There's just 1 feature or 2 features which are given here. The pallor, failure to thrive, and prominence of forehead are given. You need to describe other features here, carries 3 marks. What are the likely, enumerate various lab tests and the expected reports in each test to support your diagnosis. Now that this is hardcore pathology now, so therefore it carries half the marks, 5 marks here. So the 5 marks for the lab tests and their interpretation, while the other aspects which are in the form of integrated learning assessment carries 1 + 1 + 3. So this is a clinical scenario based question in the setting of learning of pathology. That's a long answer question. Now, another long answer question can be, enumerate various histologic types of lung cancer as per current classification. Now, this is assessing the knowledge as regards the current classification is concerned. That carries 2 marks. Discuss major etiologic factors and molecular mechanisms of lung cancer. Now, this is the up-to-date knowledge of the learner, which needs to be evaluated, carries 4 marks. So you can divide it further into etiology as 2 marks and molecular mechanism as 2 marks into it when you are evaluating it. So it carries 2 marks for classification, 2 marks for etiology, 2 marks for molecular mechanism. Briefly discuss morphology of 1 common type of lung cancer that is not associated with chronic smoking. We all know the non-smoking associated cancer has become more common and widely prevalent. Or you can ask smoking related cancer, even whatever you want to ask in your question. So you define that. So it is an analytical approach of the learner, that you are trying to evaluate the learner indirectly, whether he knows which ones are not smoking related cancer, and then describe the morphology. When we say discuss the morphology, we're talking of gross and microscopy, which is again hardcore pathology. That carries 4 marks here. So the distribution of marks therefore will be 2 + 4 + 4 as components of this long answer question. This is just to give some example of long answer questions. Then the short answer questions are relatively easy in the sense that we've been using these as short notes over the decades. Therefore, there may not be much change, except that we need to have more of the applied aspect and always have prefixes to specificity to the question rather than giving the broad question. The compare and contrast salient features of primary and secondary amyloidosis. Compare and contrast, we've been asking this for decades now. What are the various ways in which acute leukemia may present in different age groups? Now, this again is an indirect question. Analytical capability of a learner is being assessed. Now, various types of leukemia, acute leukemias, we are going to assess the lymphoid leukemia and myeloid leukemia, which one presents in different age group, and what are the various ways, like the physical findings which are present in these cases, besides presentation at different age. So all those clinical features or physical finding features will come to discussion here. So integrated approach and analytical approach. Role and significance of serum cardiac markers in myocardial infarction. So we are asking, what are those serum cardiac markers? What is their role? That's one. And other significance, which means their values and their time scales. When do they rise and when do they come back to normal? So therefore, role and significance of serum cardiac markers is specificity to the question. Now, morphology of renal manifestations of long-term systemic hypertension. Now, we are clear here that we are asking morphology, which means gross and microscopy, renal manifestations only, and long-term systemic hypertension. So therefore, here we are asking about hypertensive nephropathy and its gross and microscopy. So therefore, there is specificity to each of these short questions. Then are the questions which are in the form of multiple choice questions. Now, there is such a wide spectrum of multiple choice questions, a variety of ways they can be prepared. And there are several question banks also available, but it's preferable to frame your own questions. That is always better, because then you keep on adding to the question bank and share it with other institutions as well. I have brought here a few questions of different types. Now, accumulation of which of the following substances indicates aging at cellular level? A simple, straight memory level question, lipofuscin. Now, this is memory based. So this is simple question. This is such questions should form very small percentage of the total MCQs. These are memory based questions only. Now, hypersegmentation of nuclei, that is shift to right more than 5 lobes. Everything is defined in the question itself. We are not assessing whether the student knows shift to right or not. We have defined that. We only want to assess one component here, whether he knows that the hypersegmented nuclei are present in one particular type of anemia. We are not asking them to define hypersegmentation. So the hypersegmentation is defined here. Shift to right or more than 5 lobes per nucleus is a feature of which leukemia? Aplastic, autoimmune hemolytic, iron deficiency, or megaloblastic. So we just want answer to the type of anemia, not definition of hypersegmentation here. So this is again a question which is kind of memory based. Now, all the following are risk factors for endometrial adenocarcinoma except diabetes mellitus, granulosa cell tumor, hypertension, and obesity, and multiparity. Now, this is again an indirect question, but not negative question. It is not that which of the following is not a risk factor. That they have not recommended. So you defined the risk factors, but which one is not a risk factor here is multiparity, because instead it is a nulliparity, which is a risk factor. So you've given it a different language. All the following are risk factors of endometrial adenocarcinoma except multiparity. Instead, it is actually a nulliparity. Now, this is a clear clinical scenario-based question where you find that 60-year-old man was admitted to the hospital complaining of painless jaundice of 10 days duration. Clinical examination revealed a mass in the head of pancreas and multiple nodules in the liver, considered to be metastasis from a pancreatic primary. So what is the most likely route of metastasis of the pancreatic carcinoma to the liver. Arterial spread, lymphatic spread, or transcelomic spread, or venous spread. So here we've given a short history of a primary in pancreatic cancer and spread to the liver. We want to know the route of spread in this clinical scenario based question. And we all know that it's a portal route of spread to the liver. So therefore, venous spread will be the answer to this question. Now, again, a clinical scenario-based question can be like a lipiduria and massive selective proteinuria in a 5-year-old boy showing signs of generalized edema responding well to steroid therapy are most likely caused by which renal disease? So clinical data given and 4 types of renal diseases given: membranous nephropathy, minimal change disease, post-streptococcal glomerulonephritis, and Knox-Schondelen purpura. Now, in this child, lipiduria, massive selective urea, and this with generalized edema. Now, this fits into minimal change disease because the patient is responding to steroid treatment as well. Membranous nephropathy is also associated with nephrotic presentation, but that is not a common condition in children. So it's a child, and this child responded very well to steroids. So therefore, minimal change disease. So clinical scenario-based question with option 1. Another clinical-based question is a 70-year-old man treated previously for coronary heart disease, lost consciousness, and was brought to the hospital unresponsive to external stimuli. He recovered somewhat, but next day he was found to have developed left-sided hemiplegia. He died 3 days later and an autopsy was performed. What is the most likely pathologic finding in the brain? So part of it is clinical, part of it is assessment of pathology, because we're talking of autopsy as well and not clinical scenario only. Now, obviously, this patient had stroke, and following stroke, this patient died within 3 days. So this patient therefore had stroke because of ischemic infarct, which could be atherosclerotic kind of atherosclerosis in the blood supply. Now, this is a question which is a little indirect in the sense that, just a minute, hide video pen. Yeah. A 55-year-old man with a 6-year history of type 2 diabetes mellitus comes to the physician for follow-up. He keeps a diary of his blood glucose level, which have ranged from 100 to 180 milligram per deciliter over the last 3 months. His only medication is metformin. The patient does not use tobacco or alcohol. He consumes a balanced diet rich in complex carbohydrates and jogs for 40 minutes every morning. Lab analysis shows a hemoglobin A2 level of 7.5 gram. Normal is this. Which of the following is the most likely explanation for this patient's abnormal lab finding? Now, this question is a little complex and is analytical to assess the sharpness and focus of the learner. Now, this is a 55-year-old male whose history is of a diabetes mellitus, type 2 diabetes, for sufficient duration, 6 years. And he's meticulous in keeping blood glucose level under control, 100 to 180, and he's controlled with medication and does not use tobacco or alcohol, which also supports that it's not likely to aggravate. He consumes a balanced diet rich in complex carbohydrates and jogs for, so taking all precautions. So diabetes is well under control. Lab analysis shows hemoglobin A2. This is where the complexity lies, because a learner generally jumps to the possibility of diabetic nephropathy in this case. While the diabetes in this patient is so well controlled, he jogs, he starts a complex carbohydrate diet, which is balanced diet. His blood sugar level is also pretty good. All things are good. But just because there's a history of diabetes mellitus for 6 years, the learner is, stimulated to jump to diabetic nephropathy without looking at it that this is HbA2 and not HbA1c, because lab analysis shows a HbA2 level of 7.5% and not HbA1c. The learner, if looking at it superficially, will think of it as diabetic nephropathy, that there is 7.5% HbA1c, but it's not HbA1c, it's HbA2. So therefore, the answer is beta thalassemia trait in this case, and not diabetic nephropathy. So this assesses the sharpness and analytical approach of the learner. Another question is image-based. Now, there are a couple of image-based questions which you can incorporate in your assessment. Now, this figure illustrates the microscopic changes in the bone marrow SP rate of a 60-year-old man. Which lab abnormality is to be expected in this man? Now, this is the image given in the question. And the options given are leukocytosis, polycythemia, A-gamma-globulinemia, and monoclonal gammopathy. So obviously, there are so many circled sheets of abnormal and normal plasma cells. So therefore, we're dealing with the case of multiple myeloma or monoclonal gammopathy. Another image-based question that the figure here illustrates the microscopic changes in a case of myocardial infarction. How many hours or days have passed before these changes evolved following the coronary artery occlusion? So obviously, in this myocardial infarct, you're finding predominance of neutrophils, numerous neutrophils causing necrosis of the myocardium, extensive infiltrate. So obviously, the extensive infiltrate appears after about 3 days, 1 day to 3 days. Within 3 days, that's the maximum when you have peak of neutrophilic infiltrate the myocardium. The initial period has very few neutrophils, but they dominate in 24 to 72 hours. And after about 3-4 days, the neutrophils start dying, and then they are replaced by macrophages dominating, and proliferation of the fibroblasts as well. So 24 to 72 hours would be the option here. Still another question which can be image-based is the slides here illustrate the light microscopic finding as well as immunofluorescent findings. So light microscopy and immunofluorescence studied with the antibody to IgG in the kidney biopsy of a 30-year-old man with nephrotic syndrome. So what is the diagnosis here? Acute glomerulonephritis, membranoproliferative glomerulonephritis, membranoproliferative type 1 or type 2, or membranous nephropathy. So obviously, here you're finding nice thickening of the GBM, which is obliterating the tuft, and that is well highlighted in these immune deposits, in these IgG deposits, which are forming thick rim-like appearance around these the capillary tuft. So it's a case of membranous nephropathy, and it corresponds to the same thickening as in the H&E staining. So these are some of the examples which we can look at for types of questions, whether long answer type, short answer type, or the MCQs. Then is the competency-based practical or skill assessment. Now, this has been practiced in many institutions over the years in variety of forms. And that is in the form of development of stations. Now, rather than giving them just the questions with the set of slides or set of skills to be performed and then a viva taken on the seat, instead, it is a better idea to give them, assign them stations with the history, with the spot, or with the task to be performed, and then answer it on the sheet. And then there can be discussion as well. Now, this gives more objectivity to the evaluation. If you do it with a station where there is a card on which there's a history and there is a spot, or there is a object lying there, or a slide or a specimen lying there. So there can be variety of stations. There can be so many possibilities of such stations. So these stations can be in the form of histopathology slides or hematology slides or cytology slides with a brief history and 3-4 questions framed along with the history relating to that slide. Or there can be museum specimen placed along with the history and a couple of questions which are prepared and given to the entire batch so that there is uniformity in the evaluation. And likewise, there can be clinical pathology spots like, urine examination or semen or CSF and things like that with questions preceded with the history. And likewise, there can be instruments given to them, Westergen, Wintrow, or hemoglobin tube, RBC pipette, WBC pipette, bone marrow aspiration, Trefine, and so on and so forth, and with a brief history and some questions relating to that. Now, this has been practiced in many departments where I have visited as examiner when I was in active service. All Institute of Medical Sciences has been one institute which have been practicing stations very well and very effectively and being useful. Now, the stations are in the form of the equivalent of the OSCE, which is in the form of objective structured clinical examination in clinical setting, while in our setting, it will be objective structured practical exercise. So it's a counterpart of OSCE in practical lab, that's OSPE. So we can practice those OSPE as the criteria of evaluation of these skills or practicals. Now, the problem is integrated curriculum. Sometimes, some of those exercises are to be covered later in later years. Will there be an integrated examination or not? That's a difficult question to answer, because then the sense of belonging of the student to that specialty, if somebody is having an exam in medicine and a person from pathology is sitting in the examination, or an exam in pathology where a person from medicine is sitting, becomes a problem situation. What is more important? Medicine is more important in pathology, or pathology is more important during a medicine exam? So therefore, integrated examination is a difficult question to answer at this stage, because it requires a lot of cooperation and working together. Then a formative assessment should also be carried out in practicals and not in theory tests only for the second prof. The formative assessment during the year when they are with the department should also be done. Just to give one or two examples here, for example, how placed along with this brief history, placed a picture, but you will place a specimen there. The gross specimen of opened up heart of a 60-year-old deceased who had chronic hypertension is given to you. What is the most likely gross diagnosis? Enumerate 2 common causes for this condition. So these are the 2 questions given now, and you can give allocation of marks. The entire batch performs in this way, rather than placing these specimens only in Viva and asking them subjective questions, which the student may have prepared all except the hypertrophy of the heart. And he has read everything about heart, but he doesn't know that. So then this kind of criteria eliminates that kind of subjectivity, and it becomes more objective, and more options are also given, because this is not the only specimen you're asking. You are putting 2, 3, 4 specimens in the stations, and likewise a couple of slides. So therefore there is more variety, and the entire batch is having the same questions, and therefore there is kind of objectivity to this. Another question, if a glass slide, a microscope rather than a picture, not a picture, but a slide. Here I placed a picture. A 12-year-old boy, the history given is a 12-year-old boy comes to the orthopedic surgeon with complaints of pain and progressive swelling around his knee for 1 month, which does not improve with rest. There's no history of any trauma. Local examination shows diffuse hard swelling around the upper part of the right knee. So that's the brief history given. The questions asked are on the slide, which is given on the microscope. What is the probable diagnosis? The osteosarcoma. What is the common region of bone from where this lesion commonly arises? You want the candidate to answer metaphases. And what is the radiologic appearance of this lesion? Again, a 1-word answer, that, sunburst appearance. So you have 1-word answer to all 3 questions you expect that from the entire batch on this glass slide. So there is a uniformity or objectivity in evaluation. So likewise, you can have spots for, clinical pathology or hematology or cytology or urine exercise or instrument and all those things can be done. I haven't brought out all of them because all of you are experienced enough to do that. I have brought out this new educational material in the form of Pathology Simplified for examination preparation, which is exclusively on short answer questions and 3 types of MCQs, which are given online. The hard copy includes the short answer questions, and the online component of this simplified pathology is in the form of MCQs, clinical scenario-based questions, and image-based questions. So there are about 1,200 to 1,300 questions online, and the short answer questions is the review of the entire pathology, which I brought out along with my friend Ivan Damjano from US. And we expect this to be useful for both continents, in Indian continent as well as in US for USMLE. This is the online page of that. Then we come to the newer aspect of assessment, online assessment. Now, the pandemic has brought out changes in our criteria for evaluation also. That examination or evaluation is conducted from a distance. Now, pandemic has challenged medical educators to this extent that half the batch or the entire batch turned out to be COVID positive, and examination also has to be carried out. So therefore, the examination is online. So that is another challenge which has come during the recent times. It becomes more problematic to assess the skills by this criteria or attitude by this criteria when the student is online rather than physically present. It is expected that this experience of teachers may continue beyond the pandemic also by having online learning. And that has many challenges, but some advantages too. Some advantages are that there's a flexibility to learning. The learner can learn at his or her convenience, and there is a greater learner involvement. There is a lot of self-learning as well, self-directed learning. When assignment is given, the students prepare and come up with just discussion or asking questions. And the collaborative learning, when you give it to a group for group activity, that you learn, ischemic heart disease or learn rheumatic heart disease, or you learn lung cancer and come up prepared with it, and we'll discuss this. So you give them assignment as a group, and they, they perform this task as a group. So there's a collaborative learning. Now, how to involve students online? One of the ways, self-directed learning, like you give them an assignment and you become a facilitator rather than, throwing the information load on them. So rather than throwing the information load, you give them an assignment, and then you will be able to have an input from the students as a facilitator. Now, in this scenario, there has to be wide interaction with the content. The students are free to, consult the books, internet, or all other sources, or higher levels of books as well, not pathology alone. If they read from Harrison also, it's preferred. So they have to interact with the wide content. They have to interact with teacher, and also not only the immediate teacher, but other teachers as well. Not the teacher who is going to take that class, but they can consult other teachers as well, or senior teachers as well. The presence of teacher, therefore, in such a scenario will have to be either physical or virtual. And that is how the students can be taught and assessed. Now, online assessment is nowadays incorporated into online teaching. That is a supplementary kind of online assessment. Now that is possible if you have the technological know-how and the software to carry out that kind of online assessment. There are a variety of ways of that online assessment, but if not feasible, then of course, after an online teaching session, it'll be good to have a traditional assessment after an online session. And the appropriate, timely, and specific feedback is paramount after any online session, because that is how the students will perform better next time, and that is how you will be able to monitor their progress as well. Now, various ways of online assessment which have been developed as tools for online assessment include, before you take the online class, then you give them a test before taking the class to have their baseline knowledge. How much do they know before you start the class or before you carry out the skills before them? What have they learned up till now, or whatever they know from their knowledge of biochemistry, anatomy, or physiology, and whatever. So have the baseline knowledge, and then have a post-test also to know how much they learned is one way of online criteria. That may be in the form of quiz or giving them a couple of MCQs online, give them a few seconds, and on the toolbar on your screen, you'll be able to have the evaluation of the quiz or the MCQs as well. The other is, while you're taking the class itself online, the assessment can be done online, teaching itself. You break the class in between and give them a 1-minute test, the midway test, and you get the feedback on that. So break up the session to assess their knowledge or to see whether they are focused or they are able to recall what you taught them, or they are understanding it or not. The other criteria is by having a poll. You ask them some question and conduct a poll online is another way. And so therefore, these are some of those criteria which can be built in online teaching for online assessment. So therefore, online assessment requires to be inbuilt into online teaching as well, whether summative or formative assessment as far as possible. Now, how is e-assessment different from traditional assessment? Let's understand that. Many teachers probably understand that it's a change of, from paper to an electronic format of that paper. So send the paper online to the student, and they solve that question. That's not the case. So it's not a change of the paper-based questions to an online, scanned page given to the student. That's not e-assessment. So there are a variety of question format, like you can give them matching questions, assertive reasoning type of questions, or images, or virtual clinical scenarios at OPSI or OSCE, and then evaluate them spontaneously rather than sending a paper online as a scanned copy and then evaluating them. So online assessment as a complement to regular face-to-face assessment is a innovative way. If we develop that's going to continue with us. The pandemic has taught us some new things, and that's one of them which has come into our armamentarium of learning. This is an online set of lectures which I have prepared along with two of my colleagues, Dr. Ramdas Naik and Dr. Devasys from JIPMED. Now, in conclusion, there is a sea change, the way pathology is taught now and the way it is evaluated compared to what it used to be done even 5 years back or 3 years back. There has been a major change in teaching and learning and evaluation of pathology now. All of us need to be tech savvy and therefore update our tools of technology, learn from younger colleagues so that we take advantage of the technological advance which have come in the recent times because of challenges of the pandemic. The material about pathology lab and other computer assisted learning packages is available in plenty, and learner has access to all of them. So learners now know that it's not the classroom teaching or books alone as their resources. They have a lot of other resources for learning as well. They have a much wider choice of learning. So rather than giving them long lectures or teaching everything in classes, it'll be good to give them assignments or tasks and then engage them in group discussion, because one of the problems which teachers will be facing or are facing in the current times is reduction in the time of second prof while the subject remains the same. So therefore, a lot of will have to be given as self-directed learning and engage them in discussion rather than having 3 lectures on rheumatic heart disease or 2 lectures on atherosclerosis. Integrate atherosclerosis with the ischemic heart disease and take 1 discussion in 1 hour rather than 3 lectures. So we have to save time by this way, and that way self-directed learning in integrated approach will be possible. So competency-based, student-led, that means self-directed, a problem-based, integrated teaching and learning are the need of the hour for the competency-based learning. So reduce the information load, self-directed learning, and equally important is objectivity in evaluation. Let there be no bias or subjectivity in evaluation, and that is by structuring the questions in such a way that there is no subjectivity, rather than marking them 4 out of 10 or 8 out of 10. Instead, you evaluate them on 2 plus 2 plus 2 plus 2 is 10. So therefore, evaluate them for each component of the question. And secondly, involve other team members also in evaluation. Because if the questions are such where answers are already made available to the team, then others can also participate in that evaluation. It avoids bias. It also trains the other faculty members and younger colleagues in the process of National Medical Commission recommendations of competency-based evaluation as well. So they will also learn, the younger colleagues will also learn. And the other way is that we should share our resources with each other, because there are always strengths of some departments and weaknesses of other departments. We need to know our strengths and our weaknesses and share our strengths and resources with other departments, and involve team members who are tech savvy. So most important last line of my lecture is that it's important that the teachers learn to adapt and innovate to the newer aspects. So that is most important. Thank you for your concentration and for kind attention. I'll be very happy if we get comments from other senior teachers and colleagues, because I'm just sharing my experience. It doesn't mean that's the end of it. It's just my experience. Others are more experienced than me as well. Thank you.
Thank you, sir. Sir, there are few questions in the chat box. Shall I read it out, sir?
Sure. Yeah, I can hear you.
Yes, sir. With reduced time days, how to go for so many exams and feedback by one of the participant.
Yeah, that's what I said. We all understand the constraint of time now, because it's been reduced to 11 months. Obviously, we have to evolve strategy in a way that we condense the teaching in a way that some of those are in the form of lectures, others are in the form of group discussions only. So you will have to make a structure in such a way that you are able to complete the task by group discussion or self-directed learning. Give an assignment to a group of 10 students, which used to be the form of tutorial. They come prepared, and you sit with them for 1 hour and discuss all aspects of what they have learned and what they want to know from you. So that's the way. So rather than 4 lectures on a particular topic of, inflammation or healing, you assign it to them various examples of granulomatous inflammation. Okay, so you ask them to come prepared with it, and they will ask questions. You evaluate them whether they have learned it well, and you answer their questions also. This is the way you will be able to reduce the time to half. That's the only way. Self-directed learning and group discussions, that's encouraged. Yeah.
Participants, if you have any questions, you can unmute yourself and you can ask directly to sir.
The question from Dr. Arendra Kumar, sir.
Sir.
Sir, you are considered it is a various forms of assessment. Do you consider formative assessment is a part of internal assessment, or do you want it to keep it separate? Do you keep formative assessment separate, or it's a part of internal assessment?
Yes, I got it. It is considered separate. That's an informal way of knowing how the student is doing, and you want to monitor the progress of the student so that there is incremental knowledge of the student. So formative kind of assessment is during teaching itself. So that is not to be taken into consideration as internal assessment. Internal assessment is based on your examinations, which you are conducting after 3 months or 4 months, whether theory or practical. And the National Medical Commission has recommended a minimum number of exams which need to be conducted for knowledge as well as for skills. One of which has to be pre-final kind of exam. So that is to be counted as internal assessment. The other thing is that internal assessment, by the way, most of you already know it, is not to be added to the final tally of the marks of the summative assessment. It has to be reflected separately in the mark sheet. So that is to safeguard, the bias or the allegation by students against some teachers sometimes that I didn't get good internal assessment, therefore I didn't get a good final score. So internal assessment is basically to make a student eligible to sit for the exam, but is not to be taken into consideration for summative assessment. Is that right?
Yes, sir.